Chair lays out House Bill 3934 and recognizes author Chairman Frank to explain the bill.
You're all right with me doing it here?
Yes, sir.
All right, I will try to be brief. Thank you very much, Madam Chair and members. Let me just briefly tell you what 3934 does. It allows rural hospitals to enjoy the same freedom to work together that other healthcare professionals do. By rural hospitals, it simply means licensed hospitals with less than 75 beds that are either located in a county with less than 50,000 people or have been designated as critical access hospitals, rural referral centers, or sole community hospitals by CMS. Members, the reason this is important really is because rural hospitals are negotiating often with very large entities. You look at a lot of the insurance companies they deal with, they're in the multi-billions, billions and billions of dollars. Most rural hospitals are much smaller. What this allows them to do is, as other healthcare professionals are able to do, is basically to join together to just improve their negotiating power, if you will. Just with such a large discrepancy in size. One of the other things I would also note that in many cases the insurance companies have a very large market concentration and a whole lot of power over them, and so this just gives the rural hospitals the ability to work together to really level the playing field in negotiations. We do have a couple folks here to testify. And I would appreciate the right to quickly, very briefly, close.
We'll certainly give you that right.
All right, thank you very much.
Chair calls Robert Picasso.
And we may not have
O'Neill, John Henderson.
And brevity is the soul of wit at this time of night. Thank you for being
here. Well, he knows the weather's bad and he don't want to. He'd rather live than. I know y'all know the routine. State your name, tell us who you're representing, your position on the bill, and your make-up for it.
My name is Michael Honey. I'm the COO for Glen Rose Medical Center, and I am for the bill. As we know, many of you probably know, rural Texas healthcare is in a crisis mode. Hospitals, we have the most hospitals closed of any state in the United States right now. So one of the issues that we're facing as rural hospitals is being preyed upon by commercial insurance payers. In December, our hospital received a renegotiating of a contract from Blue Cross that we had since '94. The initial contract that we have that we're negotiating right now is a 70% reduction in payment to us. Being a small rural hospital, that would close our doors, and we haven't made any, to this date, we haven't made any significant headway in negotiating that contract. So, we're a 16-bed hospital. We have very little bargaining power with the Blue Crosses of the world and any of the other large insurances. And by passing this bill would allow us to partner with additional rural hospitals and to have a little more bargaining power and get a fair treatment under.
Madam Chair, thank you for the chance to testify and for putting in a long day of service to Texans. Particular thanks to Representative Franks.
We get $12 a day. We want to earn everything.
You've earned it today.
Thank you.
My name is John Henderson. I'm the president and CEO of Torch, so I work for the 161 rural hospitals in Texas, and I'm here to testify in support of HB 3934. We had a member, CEO Bob Pascasio from Palacios here earlier, but he had to get back to his hospital, so I can leave his testimony, written testimony with you. I'm pinch hitting tonight. Palacios is where Santa Claus comes on a shrimp boat. I didn't know that until I went out there.
Well, you should have brought him tonight.
As Michael mentioned, rural hospitals are struggling. We count 21 closures since 2013. That's double any other state. And there are a lot of reasons for that. But one is the distinct disadvantages we encounter in terms of volume, time, leverage, resources, and expertise when they attempt to effectively but individually negotiate contracts. So we'd love to see rural hospitals allowed to collaborate in contracting, and I'll answer your questions if you have them.
Madam Chair.
Yes, sir. Representative Gaddis.
And I don't want to, I know it's late, but very interesting concept, and I think this is a brilliant idea really for rural hospitals. But I'm just curious about the mechanics. Would there be a board? How would the board be selected? Who would be the CEO? all these type of things. I'm sure it's set out in the bill, but it's kind of late and I'm kind of blurry-eyed. But, and I'm sure I can speak with Chairman Frank about that later. But if you, very, very briefly, just, this is fascinating to me.
My understanding in a quick read of the bill is that the member hospital CEOs form that overarching board.
Okay. And I'll talk to him later about it, Chairman Frank, but you're going to have a CEO, right, of the president of the board?
I'm not sure that there is a board structure for governance purposes, but I'm not sure that has to be a hired staff CEO. You know, a member of the board could serve as chair.
Well, I'm not
Yeah.
suggesting they be paid.
Yeah.
You know, that's up to you guys. I just, you know, usually somebody's like in charge, you know, so I'm just curious.
That's right.
I'll visit with Chairman about it. Thank you.
Any further questions, members? Thank you very much. And thank you for staying here, being so patient. Is there anyone else here wishing to testify on, for, or against House Bill 3934? The testimony is now closed. Chair recognizes Representative Frank, Chairman Frank, to close on his bill.
It's a collaborative, to answer your question, it's a collaborative, so I don't think it would have that kind of structure, but I'll be glad to talk to you about it more. We're just trying to give, not asking for more money for rural hospitals, just trying to give them an opportunity to get a level playing field and let little dogs eat. Thank you.
Okay,
Have,
all right.
have to throw that in there.
Thank you, Chairman Frank. Members, the chair moves to leave House Bill 3934 pending. Are there any objections? The chair hears none. House Bill 3934 will be left pending.